20 Questions continues now with John Berman.
I'm not a doctor, which is a good thing for several reasons. Perhaps most of all, I have something in my possession right now which, if you were unlucky, could kill you. I'm not talking about this scalpel or this syringe, but my tie?
The UK has banned neckties from hospitals.
How can my necktie kill you?
It's really just a big germ swab that kind of goes around the hospital all day, soaking up all the stuff that you don't want to get to the next patient.
The treachery of the tie, the cruelty of the cravat, just one of the surprising threats Stephen Levitt and Stephen Dubner ascribe to mankind's relentless pursuit of, as the Bee Gees put it, staying alive. What's the best way to do it? The Freakonomics guys have some startling revelations about how to do it and where not to.
Most people these days go to a hospital in order to not die, right? So the worst thing is to go to a hospital to not die from one thing and to end up dying from something else.
I was extremely healthy before I went in the hospital.
Actress Alicia Cole was literally the picture of health. So vibrant she was cast to play doctors for commercials.
Fairly typical for an overweight woman in her 60s.
Then 3 years ago she went to the hospital for the removal of some uterine fibroids.
It was going to be just a routine procedure. It would take 2 days.
While in the hospital, she contracted a flesh-eating disease.
Necrotizing fasciitis. For the longest time, I couldn't even say the words. My stomach just rotted right before my very eyes. It was horrible.
On a scale of 1 to 10, she described the pain as a 25.
My 2-day stay turned into 2 months, turned into 14 months of follow-up at home, twice-a-day nursing care. When you go into the hospital for a procedure, you shouldn't then get sick.
Alicia was lucky. A report from the Institute of Medicine found nearly 100,000 people die each year from preventable hospital errors. But we need hospitals. We need doctors, right? Wouldn't we be doomed if, say, doctors went on strike?
The sad news seems to be that when doctors go on strike, fewer people die. It could be that people put off surgeries that would be life-threatening because the doctors are gone, but it may also just be that the more interactions that more patients have with more doctors ultimately leads to more mortality because of bacterial infections.
One solution might be in the palm of our hands, and the fingers for that matter. Hand washing.
Doctors should wash their hands. We've known it for 160 years, and yet doctors don't do it as well as they should.
Or as well as they think. SuperFreakonomics points out the case of some doctors who claimed they were washing their hands 3/4 of the time. When nurses spied on them, their actual hand washing rate, just 9%. So how can a screensaver save your life? At Cedars-Sinai Medical Center in Los Angeles, they had a novel solution to solving the problem of hand-mind coordination.
Get physicians and randomly culture their handprints in a petri dish.
Dr. Paul Silka led a campaign to compel all doctors to wash their hands all the time.
We had to give them a visual example of what their hands would look like if they didn't wash their hands.
And what do they look like?
They look terrible.
Nasty.
And they look nasty.
It was so gross, they put this picture on all the hospital's screensavers.
Physicians usually take a deep breath and they realize that they're putting patients at risk if they're not executing on hand hygiene.
It was so successful that not only did it make Cedars-Sinai hand hygiene improve to almost 100%, but hospitals around the country started to copy the solution.
You get your fingertips in there.
It made me curious. What's on my hands?
This could be ugly, right?
This will be ugly. You'll be surprised.
It was ugly. Check out this big gray blob of bacteria. Of course, washing your hands enough might not be as easy as it seems. We followed a nurse, and in just 10 minutes, she had to wash her hands 20 times. So Cedars-Sinai is going even further. Reminders everywhere you turn to stay clean. Special antimicrobial curtains, even disposable stethoscopes. But there are some who say hospitals need to think much, much bigger.
My personal belief is that the Japanese have it right. We should be bowing rather than shaking hands in hospitals.
Dr. Craig Fied led a federal effort to revolutionize emergency rooms. Notice, by the way, he wears a bow tie, not the nefarious necktie. Fiad spent years trying to redesign hospitals.
You put people in an ordinary room And every time they cough or breathe, what happens to that air? 70% of the air in a typically designed hospital is recirculated. So that air goes up into the vents and it comes back down in somebody else's room. And I just got to say, that just doesn't seem like a great idea.
Fiat says if he were designing a hospital from scratch to cycle in hordes of people cleanly and safely, this is what it would look like.
So you look around here and you think, I want this as my hospital?
You can bring in buses, you can bring in ambulances, you can have 5 or 10 buses all at once. The volume of patients you could move through here is incredible.
Big wide entrances here.
Not only wide entrances, but also lots of entrances. This one can get contaminated, shut down. We could still open up another entrance right down there and continue using it.
But Fiat is more than just an aviation enthusiast. He's a data junkie.
I think at every moment there's a patient somewhere who's one data element away from dying.
He co-designed a computer program called Amalga that stores and spits back every bit of medical data imaginable about every patient and doctor in a hospital. It's been a data goldmine for Dubner and Levitt to examine what really matters.
Are some doctors better than others?
In terms of saving your life, they more or less keep you alive the same. The biggest difference across doctors that we see in the ER is how much money they spend.
Surely the doctors who spend more money are better at saving lives.
Yeah, we don't see much evidence of that.
If it's not a matter of skill or money, what does matter?
It's possible, based on our results, that the female doctors are just a little bit better than the male doctors at keeping their patients alive.
They have no theory about why, it just is. Finding a woman doctor will be much easier than some of the other paths to staying alive they discovered, unless you're Albert Einstein or Cal Ripken.
It seems that the boost you get from winning the Nobel Prize extends your life by about 1.5 years.
It's a glorious day.
Baseball players who make the Hall of Fame live longer than those who were also very good and who almost made the Hall of Fame but didn't.
Finding religion might help too.
Observant Jews and practicing Christians, when there's a big holiday, they're much less likely to die before the holiday.
And Levitt says you can always invest in your future.
People who buy annuities, the fun and the challenge and the incentive to stay alive to get that next paycheck seems to work in keeping people alive just a little bit longer.
Staying alive. Anything for a buck.
When 2020 returns, how do you stop marauding mosquitoes and killer hurricanes? Meet the mad scientist who says it's simple.
That sounds loony, right? Well, in fact, I wasn't going to say it, but...
Next.